The morning's keynote presentation, There's a Reason for Hope, Responding to the Workforce Emergency, is a moderated panel discussion. Immediately following the panel discussion, there will be a presentation of the 2022 Moving Mountains Awards. But at this time, I'm going to turn the program over to the moderator of the session, Jerry Smith, who's on his way up. Thank you, Jerry.
Thanks.
And you're good
Hello.
to go.
Thank you, Maggie. Well, good morning, everyone. We have about an hour to talk about the direct support workforce. I'm going to do introductions of this wonderful panel, and if we have time, we're going to open it up to questions at the end. So at the far end here, we have BJ Stasio. BJ is a disability rights advocate from Buffalo, New York. He's the co-vice president of the board of directors of SANY's, Self-Advocacy Association of New York State, and has been employed by the Office of People with Disabilities, Office of People for Developmental Disabilities, OPWDD, for over 20 years. Mm-hmm. BJ was asked just a couple of weeks ago if he could make this, and I'm so glad you could. So very good at speaking truth to power.
Thank you for having me.
And next we have David Irwin. David is the CEO of Macomb, a community sports provider in Rockville, Maryland. He's developed several healthcare delivery systems, providing specialty integrated primary care to people with intellectual and developmental disabilities, and so much more. Amy Hewitt. Amy's the director of the Institute on Community Integration at the University of Minnesota, where she has been for more than 30 years. Works in just about everything, but workforce is a primary focus. Andy Reese. Andy has served as the director of the Department of Disability Services in Washington, D.C. since 2016, a licensed clinical social worker and attorney. Previously, he served as the deputy director for the Rehabilitation Services Administration. And Alicia Babcock-Raposo. Thank you so much for being here. Alicia, for over 10 years, has been a direct support professional with Perspectives, an agency serving people with intellectual and developmental disabilities throughout the state of Rhode Island. So a wonderful panel. So we're here to discuss the workforce. And as I look back at this, for more than 40 years, we have a tremendous amount to be proud of. It's been a triumph how much has been accomplished, going from our large institutions to more and more community-based services, to person-centered supports, the self-advocacy movement, nothing about us without us. It's a wonderful civil rights story, it really is. As you all know, we're in a dire workforce crisis, if that's the right word for it. I don't think it's strong enough anymore. How did this happen? How did we get to this point where the most important part of making community living work, the direct support professional, is in a position where they can barely do the job because of wage issues, of schedule issues? I'm going to start with Amy. So, as you've told me many times, this is not new information. You've been sounding the alarm for more than 20 years. Plenty of research about this. There's no shortage of data. The alarm that you've spoke of grew from a crisis to a systematic failure, your words, to an emergency and maybe an impending implosion. I don't know how much stronger we can get with the terminology, but how did we get to this point, Amy?
I'm not sure there's another word. The emergency came from Barb Merrill, so that's her word, but I'm not sure that we can come up with a word to describe something that's gone on for so long. And when I think about how we got here because we started from here. We built the community system on a huge decrease in wage and benefits to the staff. That's how we could afford the community. And we've just never dug out. And we haven't made data-driven decisions. The data really hasn't budged that much. If you look at the turnover rate over 25 years, if you look at the vacancy rate over 25 years, any researcher is going to tell you it's not a huge change. What the change is that we feel so hard is we're not hiring people, we're not selecting them. We're just hiring, and we hope we have enough applicants signing up to get the job that they'll stay, and they don't stay. And the data's told us over and over and over again that most direct support professionals leave within the first 6 months. So one thing I try to avoid, but this is a friendly audience, so I'm going to say it because I have wanted to say it from this place, talking to an audience for so long, and I haven't done it, but I told you so. So did Val Bradley, so did Charlie Lakin, so did Joe Macbeth. We've been telling you that by 2020 we were going to be here. And lo and behold, not only are we here based on what we knew which was going to happen, which was the demographic shift in the United States, we also had a global pandemic, and that nobody anticipated. And what has happened to the workforce and to organizations, you're going to hear it this morning on this panel. In Minnesota alone, 170 of the small community living programs that we've worked so hard over the last 30 years to create so people could live in the community, they've closed. They're gone. People were sent home to their families. People were sent to other places. How are we going to dig out from that? That's just our reality. So I think I'll stop talking. But how we got here is simply we started from here. And we've never prioritized the workforce. We've always prioritized more and more community services for people with intellectual and developmental disabilities, which we should be doing, but it wasn't a parallel path that we have to be able to have a workforce that is stable and competent.
Thank you. Thank you. And Alicia, so given how dire this position is and the struggles that we have to keep staff, you've been a recognized DSP, a celebrated DSP for more than 10 years. How do you do it? What strategies have you used to make this career work for you?
I can't say that there's any kind of a strategy. Personally, I just really like the work, and being able to help someone that wants to have a good life, wants to be a part of the community, if there's a way that I can do it, I'm going to try my best to do it.
And we're so lucky to have you. That's one of the... Thank you. Fortunately, some of the people that do stay in this job for so long stay for exactly the right reasons. They care so deeply about their work, and you have skills that are invaluable. Your work matters greatly. David, I'm going to go to you. Many organizations do not overtly value their employees. We certainly saw evidence of this in a DSP COVID study that we did with NADSP that looked at how DSPs were doing during the pandemic. And one of the many findings was that 70% of organizations did not financially support their DSPs with a bonus or a raise or anything. So, thank you for the 30 that did, but 70 did not. And wages are just one indication. Unfortunately, some people view DSPs as disposable caregivers. As it's entry work, we'll just churn through and get more people. Others clearly see valued professionals. What are you doing in your organization to value DSPs?
So we work hard to think about, certainly pay is an issue. The numbers of organizations who did not, in my view, these are my words, and I can editorialize because I have the microphone, who did not look after and walk alongside their DSPs during the crisis is astonishing. And I'm calling every provider in the organization out because we just have to do it more thoughtfully and do it better. We try and pair, folks have to pay their rent. So money is an issue, but I think it has to be, Amy and I were talking about this before the panel over a cup of coffee this morning. There has to be balance between money, which pays rent, and culture. We in the provider community tend to talk a lot about the meaning of self-determination and self-direction in supports, and we think about accompanying folks on life's journeys. And yet we don't do that with DSPs necessarily, because to your point, it's very transactional. So building culture around the support needs of our DSPs, it turns out, ends up in much more intimate and dynamic support giving. One of the things we learned through the pandemic is that, we've talked an awful lot in the industry about supported decision making. And during the pandemic, folks were scared. DSPs were just terrified, and rightly so. We were all scared. And as we leaned into this crisis, we ended up talking an awful lot with our DSPs as peers, as colleagues, as coworkers around their journey, and each person walking through the pandemic in different ways and allowing folks to be scared and allowing folks and acknowledging and affirming the fear turned out to be awfully, awfully important. And so it's culture. It's absolutely money. You can't overlook the money. And we need to start in the provider community getting serious about paying folks. Alicia makes a point that I hope will resonate with all of us, and that is people do this because it resides for them in their solar plexus. It's visceral. We have to stop taking advantage of that and being willing to. That is expertise, and it's such a gift. And providers are given this gift, and it's well worth paying for at both a financial and a cultural level.
Thank you. Yeah. And, another finding from that DSP COVID study and the qualitative was communication. The DSPs who felt really valued said, my director, my manager, my frontline supervisor checked in, they called, they showed up, they were just part of it. And equally, one of the things that worked really poorly was I never got a call. I never heard from anyone. So thank you for saying that. BJ, you've got a lot of experience with I know with a great DSP today. You've also struggled where you've not had good support for a couple of years and essentially lived and slept in your wheelchair.
Yep.
Tell us about your experience with the staff shortage. How is this affecting your life?
Well, it's unfortunate that those of us who need personal care and direct support professionals both aren't treated equally, because my DSP under self-direction can't help me get out of bed and do the stuff that a PCA needs, because it's not allowed within the rules, within those livable rules, as I call them, So my DSP is a really good human being, and she understands I need what I need and just takes care of it.
Thank you. Andy, we're facing increasing competition for workers, and at this time, we can't compete on wages. I don't know if we could ever compete on wages. Challenges with immigration policy make this worse. What are you hearing from provider agencies? What are people doing to attract qualified workers, and what policy initiatives are you aware of that are working?
So one of the things I was thinking about as I prepared for today was that unfortunately, we don't ask enough about what are you doing that works. What we hear mostly is we just need more money. And as everyone says, money is not the answer. And in fact, what we do find is there are a couple of provider agencies that really stand out as the ones that don't struggle with DSPs, and they have the staff like Alicia. The staff who somehow recognize the commitment that agency has to the people they support and to their staff. And they do reward that. And so they've been able, unfortunately I don't have the answers, but we're starting to get some of them because we're working now on gathering very specific comprehensive data from all of our provider agencies related to an ARPA initiative that we have to address wages, where we can get better data, really granular data about who's staying, why they're staying, what the wages of every individual is. And so really understanding what kinds of things they've rewarded that are working. Some of what ARPA's helped us with in terms of policy is that we've been able to expand in ways we intended in 27 to expand our technology, but the pandemic really forced us to. And what we're learning is that the people we support respond much better than we thought to technology, and that they can see it as a support, and that it does in many ways provide more independence and relieve some of the pressure on the workforce. One of the other areas we've been slow to implement self-direction, and we've always touted that as this will be an answer in the future as we implement it, but we also know within our state where one of the other waivers has implemented it, actually it's put more pressure because in self-direction they're able to pay higher wages, so what they're doing is pulling workers out of the provider workforce into the self-direction workforce. And so that hasn't worked quite as well as a policy matter. Lastly, we've been working on looking at, and this is across our healthcare agencies. We right now this summer in the district are engaged in a healthcare task force the mayor has put together to look at the healthcare workforce across the spectrum. And so we're not just looking at home health aides or DSPs, because what we recognize is that when we touch any one, we're touching all of them. Yep. And so what we're seeing is the sort of common tasks that different professions have to do, and trying to split things out. And one of the things we are looking at we made some waiver amendments a couple years ago to change some of our qualifications in the waiver that would allow more people with disabilities to provide supports to people with disabilities, because we had excluded some of them previously. What's essential when you do that is that you recognize what you were saying about each person and their ability to do it, and that you not just see each person hired as, a cog that can go in any wheel. They're a person who has unique skills and abilities, and through the training, we have an agency that does a training academy for people with disabilities that's funded by our VR agency, and also now our workforce agency, and is bringing DSPs into the field. But they are very good at identifying the strengths of the individual DSP to recognize where they can plug them in their system, as opposed to saying, oh good, we just got a certified qualified DSP who has an opening. They're really looking at the skills of this person and where they might be able to benefit. And so looking at the qualifications and being able to really individualize it. I'll say one last small thing, which is, as you said, I'm a social worker, an older social worker, so I was around before we had licensure, and what I learned in social work is just the importance of that, recognizing the career trajectory and why the person is here. Because I had a lot of people who helped me with that, because when I entered social work, I thought, interestingly, that as I took my first social work position, I thought, wow, I'm making less than I did at McDonald's 3 years ago. But that wasn't why I was in that job.
Okay, no, so many good points. And we're going to come back to the differences perhaps between other positions in DSPs in just a minute. But Amy, I want to riff on something that Alicia said. So the people that stay in this job stay because they've got a huge heart, they care deeply. I've talked to a number of DSPs who've left their job and come back because they were so concerned about the people they supported for years. It was very personal, it was family, and they couldn't leave the job, even if that meant coming back for a pay decrease. As a system, are we taking advantage of workers in this way? Are we exploiting them?
So for certain, that group of employees, we have always known about half stay, and they stay for the reasons that Alicia talked about, and half leave. That's the half that just churns over and churns over and churns over. I do think we've reached a point where we rely so heavily on the group that stays. And when I look at some recent data that we have from the survey work that we did with NADSP, it makes me start to think that we systemically are exploiting this workforce. They're women, they're disproportionately women of color, 70% are primary heads of household, and I hear executive directors say to me, I think it could have been you. Prepare. I've heard executive directors tell me, Well, during the pandemic, we had staff that were making six figures. And that just made my stomach sink. I thought that was horrible. I still think that's horrible. That is exploitation. If you think that people are working for $13 an hour and their annual income is that, even when you factor in overtime and double time, like, that's too much. That is not okay to expect of a human being who is supporting somebody. And if we're at the place that we're depending on that to operate services, we've really failed big in the workforce. So I do think yes. I also think you have to remember there's a vast array of providers. Some are very sophisticated and talented and are just going out of their way to figure out these problems. They're trying things new. They're using every penny they've got to get to their workforce. But then there are organizations that aren't. And we have to accept that there's that continuum of the type of employers that direct support professionals work for. And if they work for a, quote, good agency, they usually get treated better. And if they work for an organization that's not as sophisticated in how you support your workforce, in addition to simultaneously, side by side, the people with disabilities that they're supporting, it's a different reality for those workers.
Yeah. Okay, thank you. Thank you. Alicia, what would help you in your job so you're not feeling like you're burning out and working too many hours? And you work for an agency that is progressive and doing good things, and that helps greatly. But what would make your job and your life better? What could we do to change that?
It's already been said what Amy said. When you're hiring people, don't just hire them because they walk in the door. They got to make sure that the person really understands the work and what they're in for. When I started, I went through the training, and I was in a mixed group. Like, I had started in the deaf and hard of hearing department with children, and I was in a training with people that worked in the group homes. And the group home people were starting to talk about what they were handling in the homes, different things that can happen or come up with, and they immediately were told, oh, we don't need to discuss that here, we don't want to scare the new people. So that makes you wonder, what am I getting myself into? So I stayed away from the group home section because of what I was starting to hear. So I stayed with the kids and working in their homes with their families. But there's not enough hours just because of the way it's set up. And I needed to get more hours. And in that way, the company said, okay, well, you can work in this other department to get more hours. So little by little, I did end up in the group home in section. But I saw what they were talking about. You don't hear about the behavioral issues that the people have. You don't hear all about the medical issues. Or if you do hear about it, you're not really properly trained to assist the person until you're directly in the house. But then once you're in the house, you're not like put one-on-one with another staff so that you have a couple of days of full training on someone or two people so that you feel comfortable if you happen to be doing the overnight and you're alone, or the overnight with only one other staff. So it just comes down to proper training, honest training, and having coworkers that are there because they know what to expect and they feel that they can confidently handle what to expect.
If you had had a realistic job preview, if you knew exactly what all of your job would have entailed, would you have taken the job still?
Probably. I grew up with a disabled sister, so
Okay.
it's not like I wasn't going in blind. I know there are some of the people we have in our homes, they really need one-on-one services. I don't know if I was physically ready at the time, but mentally I knew what to expect.
Okay, thank you, thank you. David, thinking about wages and about collaboration, can we address wages in the IDD space alone? Or do we need to work in partnership with other quote-unquote caregiving and support organizations, including PCAs, home health aides, and other people supporting vulnerable citizens? And if so, what does this collaboration look like?
Right. Well, so Amy touched on the workforce crisis that is manifest in 2020. I think it's far worse than that. I think by 2030, I don't think we're at DEFCON 5 yet, and we should be. And I think it goes beyond the IDD space. Having said that, I'm an unapologetic sort of IDD guy, right? So I want us to pay attention to our workforce in this particular space in order to catalyze the potential of, human beings. That said, I think the right strategic move here is collaboration. Helping professions, particularly at the entry level, have just been for so very long totally ignored as any meaningful investment. And the workforce crisis, I think, that we're experiencing from a smallish organization in the Washington, D.C. metro area is one where direct support professionals and other entry-level workers in helping professions are bouncing across sectors. And they're all bouncing in, this is a little crass, just stay with me, in pursuit of the extra dollar that they need to pay their rent, and in hot pursuit of a culture that values them, that meaningfully values them. And so if that's true, and it's our experience that it is true, then we need to collaborate across sectors. I'm also struck by the notion that individually, I do a fair bit of advocacy work at the federal and state level. And as I said, I advocate primarily on issues within and around the intellectual and developmental disability community system. And it occurs to me that I sit down with a legislator or a public policy person who I think maybe can be brought to the side of light and goodness. And right behind me, there's somebody else representing another sector. And so we're unwittingly, perhaps, advocating for these parochial interests at the expense of meaningful progress across the helping professions. So I think all of that means, we can be unapologetic champions and rabble-rousers and social justice warriors for people with intellectual and developmental disabilities and the DSPs who work alongside them. And we can be appropriate and effective allies to other sectors within the helping professions. Okay. That's wisdom according to me at 9:13 on Monday. So
We'll come back to that, but thank you. BJ, you've spoken of the relationship between DSPs and people supported as a partnership. We worked on a public service announcement, NADSP and RTC, encouraging DSPs to get vaccinated, and it was wonderful talking to you, BJ, on that. And partnership really, really struck me. You said we can't do it without them, they can't do it without us, we're in this together. Given that, what is it that people who receive supports can do to help the DSPs, especially in terms of a livable wage?
Well, that's an interesting question, Jerry. Continue advocating for the wages, but most importantly, don't take your DSPs for granted. I say thank you ad nauseum to mine. I know I can't give them the money they deserve, so thank you has to be good for now until everybody gets their act together and fix what's broken.
And you've been speaking out in New York, too, at the legislature. I mean, you know people by first name basis there.
Yeah.
How is that going? How is your advocacy going? Are you getting any traction?
Well, I wish I could say yes, but we still have a long way to go till people like me aren't sleeping in their chairs and get what they need without having to worry, where's the next staff going to come from? I don't want anybody to go through that. Luckily for me, I don't have to worry about that because I have a good team behind me, and if I don't, I put somebody else on the team.
Okay.
Because people, if they want to stay, they stay. If they don't, they don't. You know, it is what it is. It's the way things are, and we're just adapting. But luckily for me, I have a good team, and they know how important the advocacy is, so they're on this ride with me every step of the way. They say, whatever we need to help you with, we'll make happen, and I appreciate them for that.
Okay. You've cultivated a good team. You brought people together with you.
Yes.
This last question, I'm going to start with you, Andy, but it's for everybody up here, and it speaks to collaboration as well, but standard occupational classification for direct support professionals. Something that needs to happen. NADSP's had a petition for a couple of years now with over 20,000 signatures. People are behind this. Can we really make this happen? Simple question there, Andy. Can we make a standard occupational classification? Can we recognize DSPs professionally in the Bureau of Labor Statistics as a profession?
I sure hope so. I mean, I think it is so important. In DC, as part of our Workforce Investment Board, they worked on career pathways in health fields, and they did a great career pathway for all the different entry points into the health fields. DSPs aren't on that. And so it's essential that they be recognized for where their place is in the caregiving network. That is, you know, I think that's part of the problem is it's not healthcare, but and I think there's ambivalence about calling it healthcare because it too much relies on that old medical model. But I think it is essential that it be standardized in that manner, and at the same time, you're then going to have government in there with rigid rules about who gets in, who doesn't, and it feels to me like you could, in some respects, tighten up the workforce a little in ways that are not as positive. But I think in terms of creating real pathways, that it has to happen.
Okay. I'm going to go to David next, and I'm thinking what you're saying about collaboration too, and being an unapologetic warrior for the IDD movement, but doing so, recognizing DSPs professionally, without dismissing TCAs and other caregivers as somehow not professional.
So, can you repeat the question? Where were we heading there, Jerry?
Well, creating a standard occupational classification for DSPs, formally recognizing them as professionals, not lumping them in, doing so without throwing shade on people who aren't DSPs.
Yeah, you know, there's and also here, and I hope everyone will forgive me, but it flashed into my head that this ain't rocket science, right? Should there be a job classification? Of course there should, and I'm not sure why there's a debate on this issue. It became manifest at the outset of the pandemic for us, where we couldn't find PPE. Essential healthcare workers had access to what was available, and it was a weird time, but we struggled to be heard on the need for PPE. We provide proximal care in many instances, and yet we could not get access to PPE. We could not get access to testing. We could not get access to all of the literally life-saving resources necessary to support our DSPs, who in turn were supporting people with intellectual disabilities, because we're not on anybody's radar screen. So I think that we can champion the need for a professional classification for DSPs, not at the expense of other workers in the helping professions, but consistent, frankly, with sort of the rising tide lifting all boats. Mm-hmm. And again, it's just astonishing to me. It shouldn't be, but it is. Joe has not yet beaten it into me from NADSP, but it's astonishing to me that this is even a debate, frankly. And so 20,000 signatures is arguably 1/5 of what it should be. This is a massive public policy issue, and I think we can do it, not at the expense of, but consistent with lifting all of the direct support sort of jobs.
You know, I love your use of the metaphor there, too. So often, a rising tide lifts all boats is used to justify tax cuts for people who might not need it, but putting in a real investment in the workforce.
Yeah, that's right. That's exactly right.
An investment in the workforce really does stimulate the economy in all the right ways, but it's such a hard sell. I mean, is this a hard sell because, honestly, we just don't value people with disabilities? Amy?
I think that's part of it. I think that until our communities are fully inclusive of people with disabilities, people don't see, they still don't know. I mean, all these years later, if you ask your neighbors who's a direct support professional, I bet you most would say, I don't know still. And we've been in the community a long time. And so until our communities fully embrace and include people with disabilities, they're not seeing and they're not hearing from direct support professionals.
You know, when we were interviewing DSPs for a film a couple of years ago, about half of the DSPs that we spoke with asked, what does DSP stand for? You know, we really have a messaging problem in our field. There are so many different names for this job, and I think people are trying to do the right thing and find respect and ways to elevate it, but at the expense of clarity.
I just was going to add, and we use PCA, home health aide, DSP, completely interchangeable. And so if we want an occupational classification as a DSP, we shouldn't be calling people who are in DSP roles PCAs or home health aides. And we do it all the time.
Yeah. Well, part of the title of this presentation was Reason for Hope. So we've been talking about how terrible things are. So I want to address this. I'm going to start with you, Alicia. What is something that gives you hope in your job and your career?
Oh, boy. Hope that, I guess just starting with our state legislature, that they really understand the assistance that's needed. Even if it's not someone in their family that needs it, just realize that people need 24-hour care, even if it's just to take them to the store or help with cleaning their house, but even realizing that people need someone to help them on a daily basis, really getting in their personal space. So I just hope that they understand it's serious and it's just needed.
It didn't sound like you're completely convinced that they do.
No, because unfortunately, we're always having to fight with the legislatures and give reasons and really struggle to say, listen to us.
Yep.
And it just seems like every year it comes up. Why are you doing this? Why are you taking money away? Why is it even a question of, should this still be on the ballot or even on our paperwork to keep giving money for their services? It shouldn't be a question. It should just automatically be there. And the question shouldn't be, should it be there? It should be, how much more can we give?
Absolutely. And your voice, the voice of DSPs, is needed now more than ever to say that. Andy, you mentioned some pretty optimistic things with creative approaches, but what's giving you hope now in this crisis?
What's giving me hope right now is, and this is very specific to the district, Washington, D.C., is that because the crisis, and it's across the board, not just DSPs, and for our providers, you know, it's causing problems above and then with nurses as well. It's gotten to a level that it has to be addressed, and so we do have this healthcare workforce task force that is really sitting down and looking broadly at the problem and trying to come up with solutions, recognizing that wages is a part of it, but that it's a lot of other things as well about, you know, about career pathways, about bringing more people in, about keeping people in. And following Alicia gives me so much hope because it reminds me of parent aides, home health aides who I worked with years ago in social work who were committed to the field. And there's always folks like this. And that gives me hope for the field. And then we have to figure out how to support them to grow that population of people who have that commitment and to compensate them so that they can stay in it.
Yeah. It often seems the phrase is, it's not all about money, but at the end of it, it's like, it's about money. I mean,
It's not all about money.
well, and following this to the Moving Mountains presentation, we get to hear from, things that really do give you hope. People that have found a way, despite the struggles, to make some wonderful things happen. Amy, what gives you hope?
So I think the thing that gives me the most hope is I've never seen as much action happening at the state level and at the federal level around workforce issues than I see now. There are some states out there that are very committed to getting wages up. There are states out there building career paths that will bring up wages when people achieve certain levels of credentialing, and that's new. And really in some states you're seeing education, labor, Health and Human Services working together to create the career pathways and the incentives that need to be there. So I think we're seizing the moment of where we are now post-pandemic, and as long as we don't lose that energy, and as long as, once people start getting more applicants, we don't stop the pressure, I think it will work. And the other thing that gives me hope is seeing how many DSPs like Alicia understand the issues and are using their voice to advocate with their elected officials versus, somebody said, no, Andy said, providers just come to us and they just want more money, they just want more money. That's not a very convincing testimony. If you had 100 of Alicias coming in to every elected official telling their story and telling their sacrifices and how hard it is, but how important the work is, I think we'd see a lot more change. And that gives me a lot of hope. NADSP had their first ever elected, meet your elected officials policy advocacy piece. And I think if everybody in this room could get 10 DSPs to tell their story, we continue to keep the pressure on and make a difference.
Thanks. David?
Yeah, and I would add to that 10 BJs, frankly, because BJ's story has to be heard. I'm struck by, and this is an ironic sort of worldview, I suppose, but never let a good crisis go to waste. And the pandemic has laid bare any sort of persistent delusion that systems of care are under, that DSPs aren't in fact crucial, not only to the fidelity of the service delivery system, but frankly, crucial to the lives of people with disabilities. And I'm just starting to, and so this gives me hope. Weird that the pandemic would give me hope, and yet here we are, because I'm hearing change in the narrative among policymakers at state systems, where Amy mentioned 170 Minnesota organizations closed doors for good. In Virginia, the number wasn't quite that dramatic, and yet there are providers across the country that close their doors. Well, this arguably gives less choice and fewer options to people who are supposed to be benefiting from our service delivery system. I also think that the provider community partnered up with our DSPs, partnered up with people receiving supports and their families. Turns out we make some pretty substantial numbers, right? And in the advocacy world, numbers matter, and the different stories from different perspectives can combine to create quite a tapestry to continue to champion these issues. We have to think about strategic human investment versus just going for more money.
Right.
How are we investing in our system? Build Back Better gave me hope for a minute, and then it gave me despair for the next. And yet it's the start of hopefully a long-term conversation, and we have to anchor our movement going forward in what we learned from the pandemic. The system is, in fact, Amy said she told us so, and she did. Now there's no longer a debate as to whether or not Amy was right. Amy was clearly right, and our work lays before us. So I'm actually very hopeful that we now have fodder for the fire and please God, we should start seeing some successes in our advocacy work.
David, just to clarify, I want to make sure that this was conveyed correctly. 170 programs closed, not providers.
Thank you.
BJ, what's giving you hope?
It's odd that you asked that question. What gives me hope is the conversations that we as advocates and families and providers in New York State are now having with the elected officials. But that doesn't mean we take the foot off the gas and say, okay, they heard. It's just knock on the door every month or so or every 2 weeks and say, I'm still here. Where's the money?
Yeah.
You know, I'm still here. Where's the money? You know? Yep. Exactly. Time is money.
I'm coming with you.
Yep. I'm good at it, so come along.
I want to come back to part of this, so the investment on it. I mean, and yes, Amy, you're right. You've been right for so long about this, and we know it's also a good return on investment to put this effort into the workforce, culturally, financially. Why isn't it happening? I'm kind of coming back to the same question again, but why is this such a hard sell when it is so painfully obvious to us what can make this work? Political will, fighting for money.
I mean, the solutions lie with elected officials at the state level. That's the bottom line. And so politics at the state level matter. And I think that building those relationships with elected officials at that level is critical.
I'm just going to add, because again, I call providers out, and I'm one of us, so I'm calling myself out. Yes, it's on elected officials. But providers have to put up or shut up. So my organization, and I'm but one in an ocean, we took advantage of provider relief funds. We took advantage of, and were successful with the PPP loan, ultimately forgiven. What you do with those dollars matters. Go back to the initial data that came out of the NADSP and Minnesota survey that showed that only 30% of DSPs responded to the survey indicating that they had gotten some sort of pay differential this was during the pandemic, and we're asking DSPs to literally put their lives on the line. And yet only 30% of our DSPs reported any kind of sort of wage differential or bump or bonus during that time. That's not on the state government. That's not on your elected officials. That's on the providers. So we have to finally and fully get serious about making our own strategic investments. So I'm happy to go to Annapolis or Richmond or DC and advocate on behalf of the organization for which I work. But the people who work at the organization and the folks we support are the ones who have to ultimately benefit from that advocacy work. Because otherwise, what are providers doing with the money? I think that's a fair question, and we have to hold ourselves honestly accountable and look in the mirror, and just because you didn't do X in the past doesn't preclude you from doing X in the future. And the X factor here is investing in our DSPs.
Thank you. Thank you. I'm just going to add my voice to what gives me hope, because nobody asked me. But,
Hey, Jerry, what gives you hope?
Well, as I'm hearing all of these insightful comments, too, I'm also reminded that we're all part of a civil and human rights movement. The disability rights movement, the self-advocacy movement, maybe the direct support workforce movement. We're part of something big here, and there's so much to be proud of. There's such talent, and there's such need. I mean, community inclusion matters that much. So I'm really hopeful for that vision and that it will get stronger than ever. And we've got a few minutes, so I would love to have questions from the audience. So please raise your hand, and like Phil Donahue, I'll run to you. And please say your name.
My name's Jill. Hi, Phil. Nice to meet you. So I have a question. A lot of what I've heard today is about DSPs. I understand and appreciate all of it. In particular, I feel like what I'm hearing is there is a difference between DSPs and other sort of people who give care. And I'm wondering where that comes from. I know there is a difference in terms of classification, but I'm hearing a lot of advocacy around DSPs. And for me, what I'm interpreting that as is it really comes from a provider perspective. And so it leaves out the reality that there are people who do consumer direction, self-direction, and that people with intellectual and developmental disabilities can completely self-direct and participate in the self-direction process. We talk about so much about person-centered planning and empowering the individual, and so there feels like a disconnect to me there. And then secondly, we've been talking about, advocacy, going to the Hill, going to your state legislators, and I'm wondering what kind of work has been done at this level around true coalition building and strategic plans for action. Thank you.
Two-part question. So maybe the disconnect with DSPs and how we're referring to and treating other caregivers.
So I'll take the first question. My use of DSP, for example, would include people benefiting from self-directed supports who are in turn hiring their own DSP. And so absolutely. I would also suggest to you that in states where family members can, parenthetically, should be paid to provide supports as well, would be included under the rubric of DSP. I don't know that Joe and John are going to love my use of rubric, because DSP, the fight here is for a professional classification, but in my view at least, it would include people hired by BJ, for example, and family caregivers who might be in that same position.
Jerry, I'd like to respond too. It really comes down to the job activities, the job duties, the skills. And so if you look at the BLS classification of home health aide, and you look at the classification of personal care assistant, and then you look at studies that have been done about what is required, what the knowledge, skills, and abilities of a direct support professional are, there are things that fall in that DSP column that do not, that home health aides and PCAs don't do. And, I'll give a good example. Medication administration, medical treatment, going into the community and building relationships with community members to support somebody to get a job. I could just go on and on and on to name skills that DSPs need to have that home health aides and PCAs don't need to have. And I think I wasn't surprised, shouldn't have been surprised at what BJ said about how he has a PCA is allowed to do this and a DSP is only allowed to do this. That doesn't make sense. Like, a person should be able to do it all, but that's where policy kind of gets in the way. So the differences are really around what we know about the required skills of the occupations.
I understand that. My question is around, I understand the differences. My question is around if we're advocating primarily for the more professional element where they can do certain sorts of skills, and we are not looking at the big picture. It feels to me like we are taking away from building a career ladder for people, and I think that's really important. So people might come in at one level where they don't have to have those skills, but it's something to strive for. I just feel I would like to see us looking at all of the elements and how they work together.
Which I'd like to respond to, because I think that is exactly what in building our career ladders in DC, what we're trying to do is to look across the board. And this was why it was challenging that DSPs didn't have their own classification, is that in the first draft they've been left out, but now we're making sure they're in the next one, and that we're breaking down what are the tasks in each and how you have a career ladder that could go across or up in every different direction. So,
and I know that's how NADSPs thinks about this work. And I would just add that home health aides and personal care assistants should be talked about and considered professionals too. The work they do is at a professional level too.
Hi, Amy. I'm Shannon McCracken with Anchor. I'm not on the panel, but I just did want to answer some of that. In regards to collaboration, it's just important to acknowledge the collaboration that is happening and has happened the last couple of years. We've worked tirelessly over the last, at least the last year, or Build Back Better or whatever. That feels like it's gone on. I feel it in my bones, 15, 16 months. But we have collaborated closely because the administration said up front, it is imperative that the disability, the aging, and the labor groups really are in line on this ask. And that's a big ask to come together. But I feel like we've done that really successfully and will continue beyond this. And we'll make sure that we continue. But we've worked with Caring Across Generations, for example, the National Domestic Workers Alliance, Leading Age, forgetting now, but SEIU, AFSCME, the ARC. So all of us have aligned on those things. And as regards to the SOC, we just released, and I'm excited for everybody to see it, we released on Friday and previewed it with Joe, with NADSP. We commissioned a report from Health Management Associates on how the SOC, why that's so important that in the absence of having a SOC for direct support professionals, how states utilize various SOCs, sometimes in really weird ways, to build rates. And when that's done, it's done in a very convoluted manner, but then it's done at a point in time where it may not be reviewed again for years and years and years. So, and while that's a state issue, it's just really important, it's the last point I'll make, is on that it is so important at the federal level because this becomes an access issue. And so we hope that the SOC and this information is a first step in addressing how wages or how rates are set, which direct wages. So.
Hey, Shannon, before you give over the microphone up here.
Oh, hey.
Just explain SOC to everybody in the audience so that folks know what it is.
Oh, I'm sorry. I thought you all did. You've got the SOCs. The standard occupational classification. And while I love visuals, so I always explain it as there's a bucket for every job in America, and that's where any data on those jobs go. So then when you can pull reports, and it's so easy to pull those, there's no bucket for a direct support professional. So that information goes across different buckets and is diluted. So we've worked since 2020 as a group and to try to get that legislation passed and excited to bring it back in an even bigger coalition, a bigger and better way, and coordinating with the advocacy that NADSP has really elevated across to get that bucket for DSPs there, so we direct all the data and information there to build this foundational case for our work.
And thank you for that visual. That's a really good way to think about it. We're out of time, so I'd please give a round of applause to our panel.
Thank you, Jerry, and thank you to the panelists. I think we need another round of applause for Jerry and the panel.